day everyone, my name is Eileen Grace T. Danyan from BSN 111D. So now I'll be assessing the cardiovascular system. The cardiovascular system consists of heart, veins, arteries, and capillaries. These components make up two circulatory system, which is the systemic and the pulmonic circulatory system. The cardiac cycle consists of two phases, the systole, which is the relaxations, and the diastole, which is the contraction. Prior to perform the assessment, review the medical record of the patient and check for the doctor's order for the need to perform the assessment. Determine the scope of the assessment and prepare for the necessary equipment such as stethoscope, the centimeter ruler, rectangular card, and also the pen light. Perform hand hygiene. And apply gloves as needed, and observe for the appropriate infection prevention procedures. And greet the patient politely. Good morning, ma'am. My name is Eileen Grace T. Danyan, your student nurse for today. May I see your wristband, ma'am?
Yes.
Please state your complete name, ma'am.
Lorena T. Sereno,
Your birth date, please.
December 6, 1970.
Okay, thank you. How would you like me to call you, ma'am?
Ma'am.
Okay, ma'am. So today, I'll be assessing your cardiovascular system or your heart to check if there is any abnormalities of it. And also, ma'am, I'll be asking you to do some movements, ma'am. Is it okay to you, ma'am?
Yes.
And also, ma'am, I'm gonna touch some parts of your body, ma'am. Is it okay to you, ma'am?
Yes.
And rest assured, ma'am, that all of the findings that I'll be documenting will be kept confidential between me, you, and the attending physician. Okay?
Okay.
So do you have any questions, clarification that you wanted to raise? Okay, thank you. Ensure the privacy, comfort, and the confidentiality of the patient, and drape the patient as needed throughout the assessment. So now, ma'am, I'm gonna closing the window and also the door so that no one in the outside will disturb us while we were doing the assessment. Is the room temperature is alright, ma'am? Ma'am, I have some question to you, ma'am. Is it okay to you?
Okay.
Do you have past health history like angina?
No.
In your lifestyle, ma'am, what do you do every day? Do you exercise like that?
Yes, exercise.
In your sleep, is it enough?
Enough.
In your diet, is it balanced or not?
No, balance.
Okay. Stand at the right side of the patient. Position the patient with the head of the bed elevated between 30 and 45 degrees. And also instructed the patient to turn her neck to the left slightly and shine the light onto her neck. And if the jugular distension was noted, assess for the jugular venous pressure. As needed or as necessary, raise or lower the bed 30, 45, 60, and 90 degrees. So, ma'am, can you turn your neck to the left, ma'am? And also the other side, ma'am, slightly. Measure for the vertical distance in centimeters. Bring your neck slightly, ma'am, to the left. the carotid artery cautiously to avoid too much pressure. And repeat it into the other side. Place the bell of the stethoscope over the carotid artery and ask the client to hold her breath for a moment and auscultated for the carotid artery, listening for the breath. So, ma'am, can you turn your neck to the left, ma'am? I'll be palpating for your carotid artery. Okay, so on the other side, ma'am, slightly. So now, ma'am, I'm gonna listening for your carotid, for the breath, ma'am. So, I'm gonna asking you, ma'am, to hold your breath for a moment, ma'am. So, ma'am, can you turn your neck again? Hold your breath, ma'am, for a moment. Okay, thank you. Other side, ma'am, slightly. For your breath, ma'am, for a moment, please. Okay, thank you so much, ma'am. Begin the general section of the chest wall. So in my case that my patient is women, I'm gonna keep the right side to be draped. Stand at the right side of the patient with the bed of the head elevated between 30 degrees. Shine a tangential light across the chest wall. Simultaneously inspected the pericardium pulsations while palpating the aortic area, pulmonic area, tricuspid area, and the apical area. Palpated heads and the lifts using the palm. For trails, press the ball of the hand firmly on the chest to check for the buzzing. Palpated impulses using the finger pads flatly from aortic area, pulmonic area, and the tricuspid area. Palpate the apical impulse using the palmar surface to 2 to 3 middle fingers. If unable to palpate the apical impulse with the patient supine, reposition the patient to roll the partly on the lateral side. Inspected and palpated the epigastric area at the base of the sternum for the aortic pulsations. Assess for the heart rate and rhythm. Place the diaphragm of the stethoscope at the apex. Using the diaphragm of the stethoscope first, then the bell, auscultated the heart and all 4 anatomic sites: the aortic area, pulmonic area, tricuspid area, and the apical area, or the mitral for the heart sounds, extra heart sounds, and for the murmurs. and ask the client to breathe normally. So now, ma'am, I'm gonna auscultate for your heart and all four anatomic sites: the aortic area, the tricuspid area, the pulmonary, and the apical area, ma'am. And please breathe normally, ma'am, while I'm doing auscultation. Assess each arm for the size, symmetry, skin color, and also the temperature from the fingertips to shoulders. Noted for any presence of edema, lesions, changes in skin texture, and also the hair distribution. Inspect the peripheral vein in the arm for any presence. Palpate the radial pulse, ulnar pulse, and the brachial pulse individually and bilaterally. Assess the capillary fill, perform Allen test, and repeat the procedure onto the other side.
Kapag matailing.
Ma'am, can you do a close open as quickly as you can, ma'am? Okay, close. Close. Can you open your hand view? Close again, ma'am. And open. At supine position, assess both legs for the size, symmetry, skin color, and for the temperature from groins to toes. Noted for any presence of lesion, changes of skin texture, and also for the hair distribution. Inspect the peripheral veins of both legs for any presence. Palpate the femoral pulse, popliteal pulse, dorsalis pedis pulse, and also the posterior tibialis pulse individually and bilaterally. examines for signs of ulcerations, varicosities, and the thrombophlebitis. Inspect the calves for ulceration, varicosities, redness, and swelling over the vein sites. Palpated the calves for firmness and had the client walk. Ma'am, can you walk for me, ma'am?
Yes po.
Yes.
Okay, walk. Okay, then here. Okay. Kasi mo ko ante. Ante.
Ano na daw?
One. So mom, the assessment is done. So you can change your clothes, mom. So mom, here's the findings that I've summarized to our assessment that we do. So in your jugular vein, it is normal. The vein is not visible, indicating that the right side of your heart is functioning normally. In assessing the carotid artery, mom, it has symmetrical volume, full pulsations, interesting and quality, and it remains the same when you breathe. So when you you turn your head and change the position, ma'am, basically to supply a nose sounds heard. All auscultating your carotid arteries. In palpating and inspecting your pericardium, your aortic, pulmonic, and tricuspid area, no pulsations. No lips and the apical area for pulsation are visible and palpable, and no lift and heights. And epigastric area, ma'am, it is normal because of the aortic pulsation. Your systole is short and your diastole is long. Normal heart sound, ma'am, it is S3 because you are an adult, ma'am. Your ulnar pulse is not detectable, and in brachial, it had equal strength bilaterally. Your radial pulse is bilateral strong. Artery walls has resilient quality. In capillary field, ma'am, it immediately back to its color. In Allen test that we do, ma'am, it launches. In your lower extremities, ma'am, your skin is pink. The temperature is excessively warm or cold. The skin texture is resilient and no moist. So in dependent position, there are presence of distension and nodular bulgence. When lids elevated, your veins collapse. The symmetric pulse volume is heard, and it has a full pulsations. It is symmetric in size lips. Capillary also, ma'am, the capillary field also, ma'am, is immediately back to its normal color, ma'am. So all of the findings, ma'am, is normal, ma'am. So I advise you, ma'am, to remain your healthy living, ma'am. So eat healthy foods, ma'am, like vegetables, and also balance your diet also, ma'am. So keep it, ma'am. And also, ma'am, thank you so much for coming today, ma'am. And I appreciate your cooperation, ma'am. And thank you so much for your full cooperation, ma'am, throughout our assessment, ma'am. Thank you so much, ma'am, and have a nice day ahead, ma'am.